welcome to In the Loop. I'm Jean Arthur, and my guest today is Councilmember Duchy Trachtenberg. Welcome, Councilmember Trachtenberg.
Thank you very much for having me, Jean.
I'm glad you came. Now, I read that you've been involved in a study on reproductive health. First of all, tell me what the study was about. What about reproductive health? How does it relate to Montgomery County?
Well, one of the issues that I've worked on for a long time, even before I got to the council, was making sure that there were adequate services for women, specifically women that qualify for publicly funded services.
Okay.
And the important thing to remember here is that for many women, a visit to the OBGYN that they see, that is their primary care visit for the year.
Okay.
So a lot of the screening around preventable disease for them, not just reproductive health issues, but for cancer, high blood pressure, diabetes, a lot of that happens at that OBGYN appointment. Okay. And so what became very clear to me the first year or so that I was here is that we really had never taken a needs assessment perspective. We've never really looked at what the actual needs were or evaluate the services that indeed are available here in the county. And remember, these are services that are either free or on a sliding scale basis.
Okay.
And what we did was we put together a work group out of my office. The work group was led by Susan Wood, who's very well known nationally for many years, having run the Women's Health Department over at the FDA. Okay. And she's now with the Jacobs Institute of Women's Health down at the George Washington University School of Public Health. And so Susan, with the help of some faculty and students and the other work group participants, again, providers, academics, people who work for the county, what they did over about a 3-month period of time is they actually did a needs assessment based on a lot of the data sets that they located through the state and federal government. Yeah. They also did an evaluation of the services that are actually provided here in the county. They did a web-based questionnaire actually to work on different parameters to come up with a sense of what were the needs, right, but more importantly, how were the services being provided, and what were the obstacles in terms of access. And what the report very clearly shows is that about a third of those that are eligible for publicly funded services are receiving them, that 2/3 do not get any access at all.
That's not good.
So, you know, one of the things the report highlights is the disparity, specifically for women of color, that this is a need that is not being met specifically for women of color, especially for women of color under the age of 25. And one of the other issues that was raised by the work group even before we actually did the needs assessment was, what are the obstacles to the access? Is it all about education and outreach? Does it have something to do with the inadequate number of sites? And
right,
clearly those are two factors. Those are two ways that people are not able to gain access to the services.
Yeah, that's something I'm trying to understand. If the county, I assume, offers some reproductive health services, but obviously you're saying that fewer people of ethnic backgrounds of color are getting to those services. What is the problem? I mean, I assume the services, the places where you can go to the services are periodically placed around the county.
Well, they are, but I think to put it into proper perspective, about 15, 20 years ago in Montgomery County, when the population was about half of what it is now, we actually had over 20 site locations. Okay. Currently, we only have 6, and our population has grown tremendously, especially for young people and for women of color and for immigrant women.
Right.
So there's a barrier because of inadequate site locations, but there's also a barrier around education and outreach. That was the other thing the report shows clearly, that it is those women where English is not the native tongue, that oftentimes they're not really cognizant of what actually they can access in the way of programming. And we have some great programming. In fact, when I started on the council, there were only 3 centers located in the county. Now there are 6. Okay. So there's been a recognition by both the executive branch and the council to fund further programming, but we've still got a lot of ground to make up.
Yeah, I'd say. Now, you talked about the education, that maybe that is a factor, that people don't know, you know, these things are available. Are we doing anything to make that, to change that?
Well, certainly there's been a lot of discussion with some of the nonprofit providers in the county. Certainly I've had some baseline conversations with the Primary Care Coalition. Through Mobile Med, they have now started to actually make, for instance, family planning more readily available, access to birth control pills. But the bottom line here is that we need to integrate reproductive health more into primary care settings.
Yes.
And we clearly need to expand the programming for reproductive health that's been in place. It's going to take a little bit of time, but the good news is that the report is a good foundation. It's an inspiration to the local hospitals and the nonprofit network to actually get more engaged on this, and I have confidence that with the recognition of the need, we're going to see more people stepping up to the plate and offering to deliver some services.
Now, is this report something that's going to the county council? Does it make recommendations to the county council? And do you know anything about what the recommendation, any specific recommendations?
Well, there were a number of recommendations, and I guess beyond building the capacity and also doing better outreach, it was suggested very strongly that we develop a work group around teenage pregnancy.
Okay.
There will be a discussion within the HHS committee in the next few weeks. I believe Dr. Wood is coming to make the presentation. I'm very excited about that, and what I would submit is that I do believe, again, it's a baseline, a foundation for future dialogue. So we will be looking at this, I'm sure, in the years to come.
So it's spring, which in Montgomery County, besides flowers coming up, it's also the budget coming out. And as you know, as everybody knows, everybody's budget's really tight. Is there any chance, do you see any chance of any improvement in the situation for reproductive health, given the budget conditions, current budget conditions?
Well, I think there are opportunities, certainly more opportunities to put a focus on private-public partnerships. That's why some of the conversations we've had with the hospitals have been particularly important, and I would expect that in the future, I'd anticipate that you're going to see more programming right on hospital site and more referrals, but money is tight. There's no question about that. The good news is the Obama administration is poised to put some more money into community-based programming. My understanding is if we have the long-awaited health insurance reform pass in the next few months, that after that there'll be some dollars put into different parts of the country, hopefully around the entire country. And one of the areas of need that they've recognized, my understanding, is around reproductive health services for women.
Yeah, if that money becomes available, it would be good if we can take advantage of it.
Very much, and there are some very fundamental public health facts that color that kind of decision making. There's, for instance, many reports that have been issued in recent years that show that one of the main reasons that women present, for instance, with heart disease in a much more advanced state is simply because they've not had the screening.
Yeah.
Again, because they're simply going to an OBGYN provider. They're not going necessarily to a primary care physician. So there's a revolution of sorts that needs to really happen in terms of integrating services, because women's health needs are much more complex than men's.